I'm Jason Cannon. I'm a professor of toxicology in the School of Health Sciences at Purdue University. PFAS are an acronym for per and polyfluoroalkylated substances, and they have been used in a variety of different applications in industry and consumer products and firefighting foams, and many in the community would know these as forever chemicals. They've been termed that because many, especially the historic PFAS that have been phased out, have very long environmental and biological half-lives. That means they don't break down for a really long time. And in terms of some of these in the environment, it could be years to hundreds of years. In the human body, the half-lives in blood may be up to a decade for some of these, meaning it may take 10 years almost to remove half of what you've been exposed to. The new proposal calls to label a couple of the historic PFAS that have the most health data linked to them as hazardous substances, meaning that if they rise above certain levels, that manufacturers or certain entities would have to report these levels to the government. And I think it's really hoped to increase the practices, the quality of the practices, and cleanup that would reduce the levels in some of these areas where PFAS are quite high. Many in the scientific community feel that they don't go far enough, just because an advisory limit is just that. It's advisory, it's not enforceable. And we've had some governments or local areas where PFAS levels are high saying they're already not going to follow these advisory limits. So I think the overall impact is unclear, given that you have compounds such as DDT that have been around for decades, and we acted too slow on those compounds, and we're still dealing with public health issues associated with compounds that have been banned decades ago. And so I think there's a lot of emergent public health, epidemiology, toxicology data that really suggest we need to act on PFAS in a very strong way.